Hi, everybody. Welcome back to part 2 of the 6 pillars of dental marketing, a patient's journey to your practice. Today, we continue to look at the most important factors in your dental marketing and what new patients are looking for when they're trying to find a dentist online. Enjoy. The next pillar that we're looking at here is personal trust and dental anxiety. So how much do I trust Peter as my doctor? If I suffer from dental anxiety, or that's something which we know a lot of Americans do, how are we helping people to overcome this or know that our practice will address it? Although online reputation often trumps formal credentials, patients do still consider a dentist's professional qualifications, especially when it comes to specialist treatments, when you're looking for the bigger case type of treatments. And I say that because, as I said to you at the start, I want people to remember, I said these pillars are applied differently depending on the practice that you want. If I'm going to have to go do a double full arch that's going to cost me $40,000, $50,000, and I'm going to find a doctor that's going to do this because this is like a massive, massive operation that's going to impact my life in many, many ways for many, many months, I'm going to try and figure out, is this person actually qualified to the best of their ability to be able to do this? And that's where personal trust in the dentist is important. People want a competent and reputable clinician when they're going to do these things. Oh, I see you have a thought, Pete. Tell me.
No, I think this is, look, if you can solve this, this is the number one reason why most people don't go to the dentist is anxiety of either cost or pain. Right. And so first principles, if you can mitigate and drive your marketing around this or your practice around this, it's a superpower. Anxiety is contagious, but also so is calm. Also showing where you have created anxious to calm patients in a testimonial over and over and over again is back to the social proof that reviews are doing.
Exactly.
So if you did nothing else in your marketing, right? I know everyone wants to say, hey, look at my labs and my incisal edges and look at all this stuff and flex on Instagram. But if you did nothing else other than just talk about taking a scared patient to a happy patient, to this was a different dental experience, you have cast the widest net. And what I mean by that is there's a 50% of the population who is scared to come to the dentist, right? So you're addressing 50% of people in your community, at least, right? Not to mention people who've had a bad experience. But if you're addressing people with veneers, you have to hit at the right time. Maybe 1% of your population is kind of looking for that at that specific time. So this is a huge thing from a first principles, and then train your team, Ian, right? Like that's the reason I named it Atlanta Dental Spa back in 2001 was because I knew that people didn't like going to the dentist, but everyone likes going to the spa. Right. And so it's a play on words, it's a little bit, but I designed everything around, I designed the environment to mitigate against things that were scary. Even so much as sharp corners in my office, Ian, I'll take it on a granular level, but drywall corners have a sharp angle, right? I know this is a little bit out there, but long time ago, it was like my guy, I said, hey, can we put a rounded corner on every corner in the wall? And they're like, yeah. And I was like, does it cost more? And they're like, no, it's just, drywall mud. Right. So like looking at sharp edges or not using red everywhere because that reminds people of blood and the noise and the thing. And we talk about this in the book a lot, right? The 5 senses. But when we are scared, what happens? Our adrenaline is rolling through, or when we are in the presence of about to be scared. So someone who's had a shitty dental experience is coming into your new practice, even though it's going to be an exceptional experience. All they have is a previous record of what their experiences were like already. So now they are running full blown. Their eyes, their pupils are dilated. Their heart is elevated. Everything is max. They can smell better. They can see better. They can hear better. They are animals out in the wilderness looking for what's going to hurt me.
And the details matter then. The curated
details
matter.
That's what I'm saying. And so it is your job to kind of fix that. And then if you see someone who is dental phobic, like make this a masterful challenge to say, team, we've already identified she's super scared. Let's do whatever we can do to change this for the benefit of dentistry, for the benefit of her health. right? And then we will get her on film talking about her experience and the transition of why it's different. And then you will have that piece of information. Then you will have that marketing in perpetuity to go on your social, to go on your website, to get pushed out in media, whatever it may be, right? But now you've addressed the biggest market. At least half people do not see the dentist.
Exactly.
Sorry, I know I went off on there a little bit.
But I love that because it matters. All of those things matter. The scent that you have in your office when someone walks in to someone that is already heightened will matter. It will either calm them down or it's going to stress them out more. As you said, the design, the paintings you have, the coloring you use, the rounded edges, how your front desk person is going to meet them. All of these things are involved in exactly that. And what you can do on the marketing side to start addressing this personal trust and then dental anxiety. Here are my tactical questions once again, Pete. Does the dentist have an updated about page on the website?
Yeah.
It is crazy how many dentists have a picture from 8 years ago to 10 years ago. They don't look like that anymore. It still talks about their dog that they had that isn't even with us, unfortunately, anymore. And all of these things, they're not representing all of the associations that they're with. They're not the extra CE that they did. Why they are the best person to place this implant or do this treatment. It's not there. So ask yourself, do I have an updated about page? And so does my team. Go look at that. Go right now, open up your website, go have a look. And also, not just the website, but on the Google Business, on Facebook, on Yelp, Nextdoor, WebMD, Instagram, on your insurance provider directories. Ask your marketing companies, how am I represented as a clinician and my practice on these different pages, and especially the website? Does the bio make the dentist the guide for the patient, who is meant to be the hero? Again, we go back to story brand. Are we showcasing how the dentist is bringing it back to what actually matters to the patient? This is why you should choose me. Not, I am the best and graduated this great and I'm amazing and I have straight A's and what does that mean to me as a patient? I want you to speak to me as a patient.
No one cares. No
exactly. Stop. You said something the other day when we did my story call with Kerry. Stop making it about yourself and start thinking about the patient. How is this going to be about the patient? Do the pictures actually represent you in a real way and your team? Go look at your pictures, as I mentioned now. Is it updated? When someone walks into your practice, will they see you or a version of you 10 years ago? And if you don't have that, just get a photo shoot done. I don't know why dentists have this hang up about having a photo shoot done. Just do it. You can do it once every 2 or 3 years, but just do it. You need updated pictures because it says something about your practice. Do you have videos on the website that's showcasing you as human? Not talking about how you're a great clinician, all of this. It's showing you as a person that's talking about why you love doing this. Very important, Pete. Do you have patient testimonials that are talking about the dentist, that are talking about you, where they're actually sharing about their amazing experience? I was super scared. I didn't want to go to the dentist. Now I do. Now I'm excited to go to the dentist. I love this place. Like those kind of videos is what's going to speak to people. If you can just focus on those for now, I think the perception that people already have within this category of personal trust towards the dentist is going to make amazing. You're going to make amazing yards on that. Then on the dental anxiety side, which, as you said now, is a major theme, here are the questions that you should be asking yourself. Does your website address dental anxiety? Do you have a place where you say, we know there's patients that find it difficult to come to the dentist. Here's what we do to make your visit more comfortable. Do you then have a page where you go into your comfort menu or sedation options, amenities that you have in your practice that you can say, this is how we do it different. I know at Atlanta Dental Spa, this is a major theme. I've looked at your website for your practices. This is all of the things that we are doing that's going to make your visit awesome. How are you doing that as a dentist? And if you're not, go look at your website. Try and see, if I was someone with dental anxiety, am I speaking to that crowd? Because it's a large group, people. It's a large group in America that struggles with it. And if you are a no anxiety focused dentist, does my overall marketing show this? So if your main thing is, I am a no anxiety dentist, I want to speak to those patients, which there are many people that's their mission. Does your branding actually represent that that's something you're passionate about?
I can tell you from looking at Google Analytics and my Google Search Console for the past 20 years, that is the most highly visited page other than the homepage, or one of the most highly visited pages is the About Us. So if you think no one's looking at it, they 100% are, right? They're going through a Cialdini's principles, right? Social proof. Okay, this practice checks the box. Website. Okay, looks pretty good. What's the doctor and the team like? And so they're going down to the page, which again, I have data that proves that people are for sure looking at it as part of their diligence. And again, outdated pictures, sometimes no picture, Ian, right? Again, no picture, massive increase in anxiety. Oh my gosh, is this going to be Dr. Scary? Is he look like he's going to hurt me? Right? Does he have friendly eyes? I don't know. I can't go to him. I can't go there because I don't see the doctor. So the antidote for that would be a picture, right? Verbiage that is talking about the patient being the hero, not the doctor being the hero. So whatever the verbiage is in your description of About Us. And then lastly, a video, a 60-second video. Because if a picture tells 1,000 words, a video tells 1,000,000. Okay.
Exactly.
And if you can just put a 60-second up and don't be don't, do it over and over again. Do it on your iPhone. I don't give a crap how you, or what you say, but practice it until you're comfortable with it. And don't do what everybody else does. We strive to provide the best, blah, 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 right? That's inauthentic. You could even start with, I'm Dr. Boulden. I want to tell you a little bit about me. I've been a dentist for 25 years, but the coolest part about me that is I've seen the transformations over this. And let me tell you one funny story or one great story about providing dentistry to someone who was anxious. And that could even be in your bio. Here's my favorite story about Sally, because that could define who you are. People will remember that, and everyone resonates with a great experience or dental phobia, right? So my point is that Ian, I get the feedback, and I know you've had a lot of interaction with dentists, but I get the feedback from many dentists that I don't know what to say. I'm uncomfortable on camera. What should I say? Whatever it is, right? They're resistant to do it. And the point is, honestly, if you got on there and you just mumbled for 60 seconds, it's better, maybe not mumble, but if you got on and just kind of just rambled,
it'd
be better than nothing.
Better than nothing. You tell them,
right?
Tell them about anything. Hi.
Tell about anything.
I got into dentistry because I love building things with my hands, and I think it's
building
super cool.
things, right? I know at early age I used to help people because I did this and that, right? And so I wanted to design an experience where it says this, or I wanted to fix smiles, or I got into a trauma when I was a kid and dental thing, and a dentist saved my life. A dentist saved my looks, and therefore I wanted to save other people. Whatever it is, just speak from the heart. And I tell you, people are not really looking at your story so much as they're like looking at, he has friendly eyes. She has friendly eyes. This person looks like they're not going to hurt me. They look kind. Again, going back to what does it cost and how, and the preservation thing. What does it cost? And is this going to hurt? Right. And that addresses is this going to hurt? Because that's the provider. Oh, they look friendly. They have friendly eyes. They look soft. They look like gentle. Whatever it is, people infer a lot of things.
Exactly. But Peter, I don't like getting behind the camera. I don't do that kind of stuff. If that is you, then you have to be prepared. If that is you, you must be prepared to accept. You will get less patience than the person that is willing.
Ian, if only business was composed of doing things we like, everybody would be doing really well. Sometimes you got to eat the damn glass and do shit you don't want to do for the benefit of your patients and your team. I'm sorry.
There we go.
And what happens, and the first 50 times you do it, it's going to suck. And this glass is going to cut your mouth, right? But by 350 times, you're going to start to get your swagger on it a little bit. You're going to actually be welcoming the camera because you've done this so many times. You've built that muscle.
Exactly. And these things that we're sharing with you today, whether it's asking for the reviews, whether it's doing the video testimonials or doing your video that you want to put up, all of these things will make you uncomfortable. It's going to be difficult. But as Peter's saying, chew the glass, it gets better, and you are going to see it in your bottom line. At the end of the day, you're going to grow your practice more than someone that doesn't. The last two pillars that we have here is the office environment and amenities. It's the fifth one I have. So although not as important, the physical environment of the practice and the level of technology and amenities that you offer, it can influence decisions. And when I say this, I want to lead with, don't tell everyone you have the latest and greatest technology. I don't care. I don't care. I don't know what it means for me. I don't know what it means for my patient journey. You just telling me We have the new iTero scanner. We have the new this. No, but if you say you don't need to put that gooey stuff in your mouth anymore, or you don't have to do X anymore, or it's going to make your turnaround time 2 or 3 times faster, then I care. But don't just tell me you have the latest and greatest, because every office says they have the latest and greatest if they bought that new scanner or that new machine. And then obviously, as I said, the office environment itself is super important. Pete just touched on that. He went as far as to round the corners of the drywall to make people feel more at peace. Other people want to use a scented candle. Other people want to have refreshments at the front door as you come in. There are many ways that you can show that your practice is actually trying. But you can't just do it in the office. It needs to be represented online. Once again, we're going back to the dental marketing side. So does your website, your technical questions, does the website have updated images of the office? Simple, but super important. Does it have updated images, or does it still have the old coat of paint that hasn't even been there in 4 years and it looks like a different place?
And have you done a 3D tour? 3D tours are great for the high anxious patient because they can visually, Google provides this through third-party outfitters. They come in and they create a Matterport, I think it's called, where they go in and you can actually tour the office from your couch. That is, again, reducing the friction, reducing the anxiety of, oh my gosh, I don't know where the bathroom is going to be. Well, Miss Jones can find the bathroom before she goes to your office.
That ties into the second question here. Is there a page or section on the homepage, on the website, showcasing the office? So I don't need to go look for it on the website. There's a 3D tour, or there's a carousel of images of the practice where I know what I'm getting into. And I would say that needs to be on the homepage. Okay. If you are showcasing tech, does it actually explain how it's improving the patient's experience? Not just that it's the latest and greatest.
Right.
The next one is, does the office offer a comfort menu that sets you apart? I know Atlanta Dental Spa is big on that too. Here are the ways and the type of amenities. Exactly. There we go. Are we offering these
comfort menu, Ian?
I don't even know that. I don't know,
well, I mean, look, invented. It's hard to invent 2 words called comfort and menu. I'm sure it's been done before,
But if you have these things, don't just have it in the office. People go online to see whether or not they're going to come to your practice. Make sure that it's showcased. Does the website offer a tour of the office? Exactly what Pete was saying there. And then, is all of the above represented on your Google business profile? Think of the Google business profile as your mini website. Before someone comes to your website, in most cases these days with Google Maps and how they're using it, they're going to find your Google business profile, and these things need to be represented. The last one, and to me, probably one of the most important pillars, quality of work and the end results. The proof is in the pudding, Peter, especially with high-cost treatment, cosmetic dentistry, and implant dentistry. A patient wants to know what they're buying. How would you know if you like that new car if you've never seen it, or that you're going to buy it? Most patients don't understand the incredible transformation that good dental work can do, so it's our job to show it to them, and show it to them in the most amazing way, whether it is before and after slider images on your website where you see a broken smile and it becomes fixed, whether it's the patient testimonial where it shows someone before where they're scared to open up their mouth and now they are smiling from ear to ear, and you can see that this person's life has been transformed. If you're interested in doing higher end work where people are going to have to cough up some cash in order to get it from you, you need to showcase to them why they can trust you for what they're buying.
Totally. I completely agree with this for sure. So, Ian, have you ever heard staging a house?
Yes,
real estate agents, right?
Yes.
There's a reason that empty homes don't sell as good as houses that have been staged, right? So if those of you don't know, in the real estate market, a residential home that's been vacant for a while will not perform well unless it's not sell at top value, right? If you just show an empty living room and an empty bathroom and empty, people will pay, or realtors will pay, to have something staged in their house. I'm going somewhere with this for a second. So, and the reason being is that most people lack such imagination and vision on what they want that they really need to be told what is ideal. So because they can't look at an empty room and say, oh man, my couch would look great over here in this corner. And look at this, is we're going to do this and this. Let's buy this house. It has to be staged to resonate with them. Same thing with your dentistry. You have to be able to show empty room, staged, right? Which would be a before and an after. What is possible? And that's the whole point of real estate staging, is what is possible. And so it's a psychological thing, because people lack the vision of the benefit to them. And so that's why we talk about before and afters, and getting one with every patient or everything that you're proud of. You know, and Ian, I talk to dentists all the time. I'm like, hey, what is the one thing that you want to do more of in your dental career? What is the one procedure? What is the one thing that you want to do more of? I want to do more implants. I'm like, okay, so I'll do it live with them. I'll go to their website. I'll look at their implant page, and it is the page that their web designer created for them many, many years ago. It's not interactive. It doesn't show a process. It has no before and afters. It was basically a set and forget to die kind of thing. And so I'll ask them, like, is this a behavior kind of congruent with trying to grow those procedures? And the answer is always like, no, but I talk about it. And I was like, yeah, but you're missing a huge thing. If you truly want to do more of something, then you have to talk about it, because it's not that you're not good at your job. It's just no one knows you're doing it. So I would be talking about it on my website. I would have a process. I would have before and afters. I would have testimonials. If I wanted to do more of X procedure, I would do a 4,000 page. I would do the longest damn web page you've ever seen. Why? Because as we know, search engines love that, right? Because it's informative. It's authoritative. It's not just the one paragraph. I would be talking about it on my displays in my waiting room. Did you know we've done a zillion implants? Did you know we use the top line zirconium implant? Are you missing a tooth? Right? Talking about it there. Everywhere, every interaction, every quote unquote touch point, I call it touch point, right? Where you in front of a patient, it's, hey, did you know? Or even, Miss Jones, I see you have all your teeth. If you know anyone with missing teeth in your family, let them know we do these implants that are incredible. They're CBCT guided. They do this, they do that, blah, blah, blah. Right? So again, not that you're not good at your job, just no one knows you're doing it. I know I've said that now. That's the 4th time on this podcast I've said it, but it's really, really important to drive home, because we have a captive audience for just a little bit of time. When they land on our website, they're a captive. When they come into our office, they're a little bit captive, but you got to leverage all those minutes that you have them to convince them to do X.
Perfect. And on that note, I encourage all our listeners today, go rewind this as you're listening to this, go down this list of questions, and just by answering these things honestly, don't bullshit yourself. Go answer it honestly. Yes, am I representing myself right? Do I have updated images? Do I have enough reviews based on what Ian and Pete shared? Do I even have before and after pictures on my cosmetic page where I want to sell cosmetic treatment? If you are answering no to these things, speak to your marketing team, speak to the people in your office that is handling this, and start to build the small steps that are going to make a difference.
I got a great. So, Ian, my kids say I have AI on the brain right now. So here's what I would do. If I love this podcast, I would take it. I would copy the link from YouTube or whatever. I would load that in. I would say, create me an audit list from this podcast, right? It would create the audit list. I would say, now go to my website and fill in using these parameters of what Ian and Pete talked about. Look at my GMB, look at my website, look at all the things out there in the internet, out there in the wilderness. How am I? And then grade me on these things from your perception, and then give me a finalized report. So it's a couple prompts, but now you have actionable items, as opposed to being like, do we do that? What do you think? What do we do? Now you have the actions, and you can use the AI to say, hey, rank the actions, what you think, prioritize based on the audit of what you just did from this pod.
Boom.
Simple, right? But this is how you should use AI, not, hey, how many cups are in a gallon kind of thing, right? Like that's how most people are using a GPT.
Yeah.
Right. But like, this is how it can augment your life. Load it with data, load it with a pod, create actionable steps, something that's going to move the lever for your practice, Ian, because I think people may gloss over some of the things we said, like, yeah, we do that. Yeah. But it'd be interesting to have it done objectively, right? Looked at objectively from someone who has no context like you do. You do, meaning the business owner that's listening. So that's how I would lever this personally.
The biggest thing, and I know I've said this before, I'm going to say it again. You hear this podcast, you throw it into the GPT and you get your list and you're like, crap, how am I going to do all of this when I already am just trying to be a business owner of a dental practice and be a good clinician? You eat the elephant one piece at a time. One thing that you do better today, just one thing, is going to make you a better business owner. It's going to make you more bulletproof. So do not underestimate how you can make small changes, and over time it compounds to where you are represented in a way that you're proud.
Totally. Yep. I think people get overwhelmed with the list of 10 things to do. And so even on my calls with masterminders, I'll stop at 3 things to do, because really no one can go beyond that. And when you go 4, 5, 6, 7, 8, it creates anxiety. 3 things is a bite size or a couple bites, right? But identify, or even have the say, hey, what is the highest and best use of, I only have time to do 1 from your audit list. Where is the highest and best use of my time to learn how to deploy and fix X? And it'll freaking tell you with amazing context and clarity. If you struggle with, right, I'm trying to give the antidote to I don't know, right? And so the antidote to I don't know is use an all-knowing, like use some help here to get the wheels turning about getting you to know.
Fantastic. That's what we got for today, Pete. Amazing.
I love it, dude. I loved it.
No, I loved it, man.
Important. I really think we bellyache about the things that are not taught in dental school, right? No business acumen, no marketing acumen, all these things. I really feel that we should have a lot more training in psychology, not psychology from a manipulation standpoint, but psychology in order to get people what they want, right? To benefit people's life. Because we are in an uphill battle with dentistry, meaning there's a lot of friction to get people to sit in our chair. No one really wants to be there. So psychologically, we have to look at some of these things. Like, how do we reduce the friction? How do we reduce the phobia? Right? Like, there's a big thing, and and reading kind of Cialdini and things like that are really good with helping people get what they want. And again, this is not not psychology from a manipulation. It's psychology so that you can make people comfortable. And at the end of the day, if you can do that and you create a better product and you let people know about it, you're going to be bulletproof. Right? If you're good at reading body language, if you're good at listening to the words that are coming out of people's mouth, if you're creating a frictionless environment as much as possible, whether it's dental phobia or learning how to pay or speaking to the benefit, whatever it is, that is the bulletproof way.
Beautiful.
Thank you, buddy. All right, everybody. I want to let you know, Ian, I want to just use this time to talk about 2 things. We have a new book out. It's freaking awesome. I love it, right? Maybe I'm drinking my own Kool-Aid. But I looked at it and compared to the one we did 8 years ago. And this one is like, I told Craig, like, this is a legacy piece for us, because I doubt that we'll put one out in another 8 years, but it's the culmination of Craig and my journey and best practices and the things we've learned through having hundreds of people in a mastermind and and 2 robust practice groups ourselves. So it's the culmination of all these things. It's a really good read. I've actually made people in my environment, some of my best buddies, read it, even though they don't have dental, they're not dentists, and they've actually gleaned a lot from it, right? Because there's applicability all across even any business. So get the book. It's 250 pages. It's only $20. Get it, support us. You will be happy that you did.
Isn't it already a #1 bestseller on Amazon?
It is. Yeah, it is. It is. I wouldn't say the category that we're in is ultra competitive dental books, right? So I don't think it's hard to, so right now we have a #1 and a #5.
Don't let facts spoil a good story, Pete. Right. Don't let facts.
I don't think it's not like sci-fi or romance novels, but regardless,
this is the best book. This is the #1 bestseller in every category.
In all 10 people who have written dental books. There's a series of 10 people we had to beat. And the second thing I want to say, Ian, is about the summit. We are doing things, obviously, Craig has alluded to the fact that we are selling tickets to large groups of dental practices. So the tickets are going out quickly. So I would encourage you, if you really want to leverage your team and your ecosystem, bring your team, bring them to Phoenix, check it out at thebulletproofsummit.com. Additionally, we are doing some workshops on the last day, on the Sunday. And so I'm doing a large AI workshop. Erica's doing an office manager, right? So we're doing some specificity to our conference. And I think they're only 3 or 4 hours, but I'm really excited about bringing kind of the best principles and best practices, or just the newest and greatest things in AI to use. And imagine how much different it's going to be in 6 months, honestly. So I'm excited to kind of bring that to the environment. But again, it's a little bit of a format. It's a little bit more involved, and you can see that on the summit. That was it.
Fantastic. Everybody,
right.
Thanks,
everybody. Appreciate it. And we will see you next time. Thanks, everyone, for watching today's episode of the Bulletproof Dental Practice Pod. We hope this conversation brought you a tremendous amount of perspective and reminded you of why you love dentistry. If you enjoyed this video, make sure to smash that like button, drop us a comment, and make sure to subscribe so you never miss a future episode. Additionally, it would really help us if you could send this message to someone that you think would enjoy it. Until next time, keep pushing forward, keep leading boldly, and most importantly, stay bulletproof.